Y'all treat all your patients like this or just the black ones? When you found out you was delivering at this hospital, your should have changed doctors. How many pregnancies do you have? She asked her that question maybe 4 times. My daughter answered it 4 times. How many children do you have at home? She just kept going with these generic questions and just dragging it out. And at that point, I'm looking at her, I'm looking at my daughter. And I asked the question, is this how you treat all of your patients or just the black ones?
A mother cried out for help, but the hospital told her to wait for paperwork. In Mesquite, Texas, right here in our backyard, a sister in active labor was left sitting in a wheelchair while her baby was minutes away from being born. And from there, her tragic story went viral worldwide. Let's talk about why this happened and how our community can protect itself from such lack of empathy. Welcome back to Affluent Blacks of Dallas, where we talk about wealth and lifestyle, but in this case, family safety and protecting our pregnant women with the best knowledge available. The viral Mesquite Hospital video showed, as I mentioned, a young pregnant sister being unempathetically delayed at the front desk over silly paperwork. For many of us in DFW, as well as brothers and sisters around the country, this hit home to the point where other sisters chimed in about their horrible maternity intake experiences at their local hospitals.
Women. In Crown Point, Indiana, another alarming video. Mercedes Wells says she sought care from Franciscan Health Crown Point Sunday. She says they sent her up to triage, where she labored for 6 hours and a nurse gave her a checkup.
After she finished, she said, well, if you're not further along and you're not past 3 centimeters in the next 2 hours, then we're going to discharge you.
Wells says she never saw a doctor, and minutes after being discharged, she gave birth in the car. And minutes after being discharged, she gave birth in the car.
But here's the good news. There are modern technologies that could prevent this from happening again. Recall in the video, the pregnant girl's mom called ahead of time to let the hospital know her daughter was in contractions and ready to deliver. They drive to the hospital. You would think the hospital would have at least asked the mom the pre-intake questions necessary to speed up the bureaucratic process. But nope. At this point, the mom was under the impression they would be ready for immediate intake. Also nope. As soon as they arrived, the staff basically cast her aside in a wheelchair and hid behind a wall of paperwork. No empathy, no medical assistance. Even nurses 100 years ago were more caring than this, and they have far less technology at their disposal back then. This wasn't just a moment of frustration. This was a maternal safety failure. And Black mothers already face higher risk across America, even when we have education, high incomes, and excellent insurance. This is about respect, urgency, and systems that protect us, our women. Imagine this same situation, but with a system built to protect mothers. A smartphone labor app that could have sent the daughter's contraction timing to the hospital, sent alerts when contractions became closer together, completed all intake paperwork before arrival, shared real-time GPS ETA as they're driving, told the hospital exactly which entrance they were pulling up to, triggered staff to meet them at the door with a wheelchair. This is not sci-fi. This is the same kind of tech used for ride-sharing, food delivery, and telehealth applied to protecting Black mothers. Do you know the percentage of sisters who are harmed by such malpractice? Comment your answer below. So why do Black families need this? Well, number one, delays disproportionately impact Black mothers. We are more likely to be ignored, dismissed, or told our pain is an exaggeration. Number two, technology creates accountability. staff can't claim, "We didn't know." Number 3, the system removes bias. Well-designed AI looks at data, not assumptions or biases. Number 4, hospitals operate more urgently. If the system says active labor, there's no debate. What this means for DFW families. Here in Dallas, Rowlett, DeSoto, Plano, Mesquite, Arlington, we deserve the same maternal safety as anyone in the country. This technology could reduce dangerous delays, improve outcomes for mothers and babies, hold hospitals accountable, give our community more confidence during childbirth. Every expecting mother and grandmother deserves this kind of support. If you want to see the full technical breakdown of how this system works, the AI, the architecture, the hospital integration, I just completed that video and it's available right now on our other channel, Digital Transformer Guy. And for more community news, empowerment, and lifestyle content, make sure you subscribe to Affluent Blacks of Dallas right here and all our other platforms. Your family's safety is worth every bit of this knowledge. Until the next video, brothers and sisters, take care.